see that you're here for a cranial nerve examination. Okay. I just have a few intake questions. Can you just spell your first and last name? Okay. And how old are you? Your date of birth? Okay. Do you wear contacts or glasses? No. Okay. When's the last time you had an eye exam? About a year ago. Okay. Well, we can definitely fit in an eye exam today. And do you have any current complaints? Any pains, aches and pains? Okay. Oh, you bumped your head? Oh, I see. We can definitely do a thorough head examination. And did you feel any nausea or vertigo after you hit your head? Okay. And how long ago was that? Oh, sorry. Can you repeat that? Okay. That was 2 days ago. Is there a reason why you waited a couple days to see a doctor? Okay. You didn't think that it was serious, but you were told that it was best to come by one of your family members? Yeah. So sometimes when you hit your head, you don't really feel it at first, but then the bump starts to get bigger, and it's always good to get checked out. I do see that you have a little, just a little bit of a bump right here. I do see that. Okay. Have you been drinking water and eating food though? You're able to eat. Okay. Any food aversions? Okay. Do you have any allergies by chance? No allergies. Okay. And do you drink coffee? Once a day? Okay, that's pretty good. Hopefully you drink enough water. How much water do you drink? Okay. Good. Good to see you drinking water. And do you take any medication? Okay. Alrighty. So we can definitely go ahead and get started. Oh, and what is your height and weight? Okay. And then your weight. Good. Okay. Any throwing up or anything like that? Okay. And when's the last time you were sick with the flu? Okay. Yeah, I can definitely feel you to see if you've got a little bit of a fever going on. It doesn't seem like you do. Let me just feel. Okay. I will definitely do your vital signs for sure. Okay. I'm just going to set this aside and we'll get started. So let me put my gloves on here and we'll get started. Are you feeling okay? All right. This examination will take about 40 minutes. Okay, so let me just set these aside. And we will start off with a very simple vital signs. And we'll start off with the temperature. So just look straight at me. Okay, 96.2, so that is not a sign of fever. But let's check your oxygenation. So could you just give me your index finger? Okay, let's just check the oxygenation here. All right, oxygenation is good. BPM is 95, so your heart rate is strong. But let me go ahead and check your heartbeat, and I want to just have a listen of your lungs. Okay, breathe in, breathe out, breathe in, breathe out. Okay, check with the bell here. Breathe in, breathe out, breathe in, breathe out. Lovely. So your heart sounds are strong, and it doesn't seem like you have any crackling in your lungs. It doesn't sound like you damaged your lungs, but let me go ahead and check your thoracic cavity anyway. So your thoracic cavity is right here, okay? This is where you have your heart and your lungs. And I'm going to be tapping on the thoracic cavity, okay? So just listening for any weird sounds. Okay, don't hear anything, but I do just want to double check. So I'm going to have another listen here. Breathe in, breathe out. Good. Breathe in, breathe out. Good, 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 good. Let me just set this aside here. So it sounds like your lungs and your heart are perfectly intact. Everything is healthy there. I'm going to go ahead and just do a really quick measurement of the circumference of your head. And so if you could just relax for me here, I'm just going to measure your head here. Okay, so it looks like the circumference of your head is about 27. So let me go ahead and write that down just so that I have that in my portfolio. Okay, and a few other notes here that everything looks fine so far. All right, so you said that you do not wear glasses or contacts. I would like to start off by doing a quick eye exam, but first, a few cranial tests, all right? So I will have you raise your eyebrows and don't let me push them down. Okay, very good. And then can you smile for me? Okay, and frown? Okay, good. So can you shrug your shoulders? Go like this. Okay, I'm just gonna try to push down. Okay, don't let me, very good. And I'm going to try to move your head. Don't let me though, okay? So I'm just going to try to move your head. I'm going to try to bring your head down. Don't let me. Okay, I'm going to try to push up. Don't let me. Great, okay. Now, can you stick your tongue out for me? Okay, and I'm just going to have a really quick look. And can you move it side to side like this? Okay, let's go ahead and do that. And let me just have a feel of your tongue here. Just gonna lift your tongue up and look underneath. Looks good, looks healthy. Okay, I do want to just have a look at your tonsils while we're at it. So I'm just gonna bring your tongue down here. Okay, just bringing the tongue down. The gag reflex, how does that feel? Not good? Okay, I didn't expect it to, but yeah, you're good there. Okay, teeth are intact, healthy, clean, very good. Are you able to go like this? Okay, you can move your mouth up and down, lovely. Let's move on to that eye examination test. Start off with a little lens on your eyes, or in front of your eyes. I'll just have you relax for me so I can add the lens there. Very good. So I want you to do a few things for me. Number one, I would like for you to tell me which fingers you see moving, okay? And I'd like for you to look at my nose, okay? And tell me which fingers you see moving. Your right or your left? Okay, good. Okay, very good. I have a few different colors I would like to show you, and I would like for you to just tell me what colors they are, okay? Okay, very good. Very good. Good. Okay. Right, you did a really good job there. Now we're going to move on to the Snellen chart here. And with the Snellen chart, we do have one right here and we have one here. And I'm going to test this one first and then this for farsightedness. So nearsighted and farsighted. We'll see how your vision ends up being after we do the test. So can you just tell me what letter this is here? Okay, and this letter here. Good, this letter here. And 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 here. And read the whole bottom line for me. All right, and point to the circle that's the biggest, and then the smallest. And what color is this? And this. Okay, all right, so we're gonna move on over to the far-sighted one here. And so if you could just allow yourself to look right over here, all right? So what letter is this? Okay, what letter is this? What letter is this? Okay, and this letter here. And this letter here. What number is this? And what number is this? And this letter here. And what color is this? And does that appear right to you? All right, you did a really good job there. So what I'm going to do is I'm going to also take a really quick look at your optic nerve to make sure that it's intact. And so that requires me to have a close look at your, in your eyes. And so I'm just going to come close here and just pull it down, pull your eyelid down. So I'm just having a look at your optic nerve here. Can you look up for me? Good, 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 good. And look down. Okay. And look to the left, and look to the right. Do you feel this? Close your eyes. Any pain? Okay, very good. Let's go ahead and check the other side. Okay, and I'm just going to change the lens up a little bit. Good. All right, so we're just going to have a look-see here. So if you could open your eyes there. Good, okay. And then I'm just going to palpate around the eye. Okay, and then the optic nerve looks intact, which is good. Looks healthy. Your retina is attached. Can you look up for me? Look down. Any pain? If you close your eyes, any pain? Perfect, okay. All right, so it looks like everything is wonderful with your eyesight. We'll move on now to your nose, okay? I will be taking a look into your nose with my otoscope here. So if you could look up for me, and we're just going to take a quick gander there at the nose, okay? So just going to take a quick gander at the nose. All right, so, all right, and I'm just having to look to see if there's a deviated septum or anything like that. I don't think that there is, and there is not. So that is good, and let's go and check this side here, okay? All right, so let's just take a look here. I don't see anything wrong with this one here as well. It looks healthy, no scabbing of any kind. All right, so let's go ahead and close one nostril here, okay? And I want you to smell something for me. So that is going to be this spray right here. All right, so I want to close this nostril, and we're gonna spray this. Can you tell me what that smells like? Good. So make sure you can smell out of both nostrils, and close this one. And let me know what that smells like. Yes, correct, yes. Let me go ahead and have you smell another tincture here. This is something that I created, a scent that I created myself. I just want to see if you can smell that. Yes, okay. What does that smell like to you? Floral berries, yes. That's correct. That is correct, yes. That's correct, yes. Okay, so I'm glad that your senses are going well so far. Let's do a quick taste test. So let me do a little dab of this on your tongue. So if you could just Stick out your tongue for me. Okay, good, 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 good. And have a taste of that. What does that taste like to you? Okay, yes, that is correct. So I have a few other tests. We're going to do a few more smell tests and a few more taste tests. So I'll have you just go ahead and taste this. Okay, and what was that like? And go ahead and taste this. And what was that like? Good. Okay, and 2 more smell tests. So let's go ahead and smell this. Peppermint. And we'll do this one. Cherry. That is correct. Very good. All right, so now I'd like to check your ears. How has your hearing been? Okay, did you hurt your ears at all? No? Okay. Well, let me do a quick look into the ears here. All right, so it looks like there's a little bit of earwax, not too much. Your ear looks really healthy. Doesn't look like you have any internal bleeding of any kind. Earwax is normal. All right, let's go ahead and check this side here. Okay, so the earwax is normal on this side as well. There's just a little bit of earwax, not too much, and it looks like it's healthy on the inside. Okay, perfect. Well, what I'm going to do is a really quick hearing test. So I do have this tuning fork here. Have you ever seen one of these before? Okay, so sorry, let me just fix my hair here. Tuning fork. This is to check your hearing. Do you hear this? Okay, so there's 2 sections to this tuning fork. There's A and B. Okay, so I want you to tell me which one is louder, A or B. Does that make sense? Okay, let's get started. So tell me which one is louder. Okay, let's do the other side. Okay, very good. Now tell me when you don't hear the sound anymore, okay? Okay, very good. Okay, very good. Now tell me when you hear the sound, tell me if you hear the sound coming closer to you or further away. And if you could, I'll have you actually close your eyes for this, if you could. That would be great, and let me help you out with that actually. So we'll go ahead and close your eyes here. Okay, so tell me if you hear the sound coming closer to you or further away. Good. Tell me if you hear it coming closer to you or moving far away. Great. Let's try that again, but you're welcome to have your eyes open. And you'll be able to tell more so, but try to use your ears. Okay, so tell me, is it coming closer to you or further away? Okay, and once again, tell me if it's becoming closer to you or further away. Good job. Yes, that was lovely. So now I'm going to do a clicking test. I'm going to be clicking. I want you to count how many clicks you hear and which ear you hear it out of, okay? Okay. Good. Okay, and now just tell me anywhere you hear it, whether it's above your head, below your head, left or right. Sort of just let me know. good. Let's do the same thing with my hole puncher here. Okay, I want you to tell me how many times you hit it. Okay? All right. Okay, very good. All right, and so what I'd like to do now is I will actually do a few more eye examination tests. And so I'm going to put this lens over your eyes, and it is going to be a little on the blurry side here, but we'll do this really quickly. So how many fingers am I holding up? How about now? And now? And now. Okay. And I'm going to have you once again look into the lens here. You should be able to see different colors. So tell me what color this marker is. Okay. What color is this marker? And this marker here. Okay. And this marker here. Okay, very good. Now, we're going to do a really thorough sensation test. This will be likely about 10 minutes long or so. And this is just asking you quite a few different sensations. So first of all, I'm going to be tapping your face very lightly with this here. And I just want you to tell me yes when you feel it, okay? So just say yes when you feel it. Lovely, lovely, lovely. All right, and we're going to be doing a sharp or dull testing here. So we've got the pinwheel, and we've also got the little white floof. So I will have you tell me if you feel sharp or dull. And just let me know if you feel it sharp or dull. Okay. Okay, very good. All right, now we're going to do, so I've got this and this. Should be able to tell the difference between 1 purple and 2 clear. So this is 1 and this is 2. Go ahead and tell me which one you feel, okay? Okay, so I'm going to incorporate a cold So this is going to be cold. So it'll be 1, 2, or cold. So it'll be 1, 2, or cold. Sounds good? Okay, let's get started. Lovely, you're doing a really good job. Okay, perfect. Let's do, we'll just do small or big. So tell me if you feel small or if you feel big floof. Small floof, big floof. Sounds good? Okay, let's get started. Okay, very good. We're going to do some tapping triggers here. So I want to tap your face, and I'll just have you tell me if you feel the big one or the small one. So this is the bigger one, this is the smaller one. Okay, and so just say bigger or smaller. Very good, okay. Now I want you to tell me if it's hard or soft, okay? Lovely. You've done a wonderful job today. I'm going to go ahead and do some measuring of the face now, and then at the end I will do a thorough head assessment, and we might even need to bandage your head after that fall. So I want to go ahead and do some measuring of the face here, and then I'll be writing my my numbers down. So let me just get my little notepad ready, and I'm going to go ahead and start by measuring. Okay, so that's about 4 inches. Measure the nose here. .5. Forehead. So your forehead's about 7 inches long. Side profile here. 3 inches. And your eyebrows. Perfect. Okay, so, and I will be measuring a few other things as well, such as the body fat. So I'll be going like this on your face. Does that make sense? Okay. I'll just write those numbers down. Very good. I'll also be using my handy dandy measuring tape here, and I will have you just close your eyes and relax as I do this. Okay, so now I want to finish off with a few different sensory tests here. So I've got this little tool here, and just tell me what this feels like. And what did that feel like to you? Okay, and another sensory test, I'd like for you to close your eyes. Let me know what this feels like. Very good. another sensory test. I want you to tell me what this feels like. Okay, if you didn't like that sound, my apologies in advance. Okay, close your eyes and tell me what this feels like. Okay, and close your eyes and tell me if this is cold or warm. And again. And again. And again. Okay, now I'm going to be writing something on your face. And just tell me what I am writing. Okay, very good. Going to be writing another thing on your face. Alright, and now I'll be drawing an animal on your face, and I want you to guess what it is, okay? Yes, that was a lion. Going to draw another animal on your face, and just tell me what this is. Yes, that was actually a black German Shepherd. Good guess there. Okay, so let me just go ahead and do just one more test here where I put a dark lens over your eyes. So this is what the dark lens is, and you should be able to tell me how many fingers I'm holding up. How about now? And now? And now? Now? Okay, you did a good job there. And I'm going to do a little bit of cold therapy on your face. I want you to just tell me if you can feel it. Okay, tell me where you feel it. Okay, very good. So as far as everything goes, I don't see anything wrong with you. Everything seems to be fine, but I am just going to do a really thorough examination of your head. So I'm just going to have a feel. Does that hurt at all? And does this hurt at all? How about this? Does this hurt? Do you feel this? Any pain here? I don't feel much of a bump. I do see just a little bit of a bump. So let me just go ahead and measure that really quick. I don't think we have anything to be worried about. Your bump will go away. It looks like it's healing. Make sure you get lots of rest, drink lots of water, and take a few days off of work. You should be healed in no time. Okay, sounds good.